There are 4 Medicare savings programs designed to help pay Medicare costs for people with limited income. And depending on which state you live in and what your monthly income looks like, one of them might already apply to you. They're called QMB, SLMB, QI, and QDWI, 4 short names for 4 different levels of help, ranging from covering just your monthly premium to covering your premiums, deductibles, and copays all at once. These aren't loans, and they're not something you pay back later. If you qualify, the assistance is ongoing for as long as you remain eligible. The reason most people never hear about them isn't that they're rare or hard to get. It's that nobody automatically tells you they exist. You generally have to know to ask. This video covers what each of the 4 programs actually pays for and the real 2026 income and asset limits for each one, according to Medicare Gov. Starting with the most specific one, QDWI stands for Qualified Disabled and Working Individuals, and it exists for a narrow but important situation. People under 65 with a disability who went back to work, and because of that income, lost their premium-free Part A coverage. Normally, once you've worked and paid Medicare taxes long enough, Part A is free, but going back to work while disabled can sometimes trigger a loss of that free coverage under certain rules. QDWI steps in specifically to cover the Part A premium in that situation, so returning to work doesn't mean losing hospital coverage along with it. It has its own separate, generally higher income limits specifically because it's built for working individuals, and it doesn't cover the Part B premium or cost sharing the way the other 3 programs do. It's the narrowest of the 4 programs, but for the specific situation it's built for, it solves a real problem. Next, QI and SLMB both do the same basic job, paying your monthly Part B premium, just at 2 different income levels. For 2026, SLMB, Specified Low-Income Medicare Beneficiary, covers individuals earning up to $1,616 a month, or $2,184 for a couple. QI, Qualifying Individual, covers a slightly higher range, up to $1,816 a month for an individual or $2,455 for a couple. Both programs use the same asset limit, $9,950 for a single person or $14,910 for a couple, for 2026. The one real catch with QI specifically is that it runs on a fixed yearly federal budget and is first come, first served, so applying earlier in the year genuinely matters, and people already enrolled get priority for renewal the following year over brand new applicants. Neither program touches your deductibles or copays, just the monthly premium. But for anyone on a tight fixed income, not paying that premium every month is real, immediate money back in your pocket. At the top, QMB, Qualified Medicare Beneficiary, is the most generous of the 4 programs, and it's worth understanding in full. For 2026, it covers individuals earning up to $1,350 a month or $1,824 for a couple, with the same $9,950 and $14,910 asset limits as the other programs. What makes QMB different is what it actually pays for. Not just the Part B premium, but also your Part A premium if you have one, your annual deductibles, and your coinsurance and copays for covered services. In practice, that means a QMB enrollee generally isn't billed directly for Medicare-covered care at all. Providers are prohibited from billing QMB enrollees for those costs beyond what Medicare and Medicaid together already cover. One detail worth knowing: QMB uses supplemental security income counting rules for what counts as income, which means roughly half of income from work isn't counted toward that limit. So some working individuals qualify even if their gross pay looks higher than the stated threshold. Here's a detail that catches almost everyone off guard. If you qualify for any of these 4 Medicare Savings Programs, you're automatically enrolled in Full Extra Help, the separate program that lowers what you pay for prescription drugs under Part D. You don't have to fill out a second application or prove anything twice. The 2 systems are linked specifically, so people don't fall through the gap between them. That matters because a lot of people who'd qualify for extra help never apply for it directly. But qualifying for a Medicare Savings Program solves both at once without extra paperwork. It's one of the few places in the Medicare system where 2 separate benefits are actually connected on the back end, instead of requiring you to track down and apply for each one individually. If you're only checking your eligibility for one of these programs, it's worth knowing you might be getting 2 forms of help for the effort of one application. Checking your own eligibility takes a few minutes, not weeks. Start by comparing your monthly income and countable assets against the 2026 limits covered in this video. Up to $1,350 a month for QMB, $1,616 for SLMB, $1,816 for QI, all figures for an individual, with roughly $300 to $600 more allowed for couples. Asset limits sit at $9,950 for an individual and $14,910 for a couple across all three, though a home you live in and one vehicle generally don't count toward that number. Applications go through your state Medicaid office, not Medicare directly, since these programs are jointly run between Medicare and Medicaid, even though they cover Medicare costs. Your local state health insurance assistance program, or SHIP, offers free help figuring out which of the 4 programs you might qualify for and can walk you through the state application at no cost and with no obligation to enroll in anything else. 4 programs, 4 different levels of help, and the only real barrier between qualifying and actually getting it's knowing to ask. QMB, SLMB, and QI cover different income bands, from about $1,350 to $1,816 a month for an individual in 2026. And QDWI covers a specific working and disabled situation on its own separate track. If your income sits anywhere near those numbers, checking with your state Medicaid office or your local SHIP costs nothing and takes a few minutes, and the potential payoff is your Part B premium, and possibly your deductibles and copies too, going away every single month going forward. Tomorrow's video covers one specific Medicare mistake that locks people into a wrong choice for a full 12 months without them realizing it happened. If today's numbers applied to you or someone you know, subscribe so you catch that one too. Here's the question for the comments. Did you know these 4 programs existed before today, or is this the first you're hearing about any of them?